There are new numbers this week from Statistics Canada showing some Canadians are avoiding routine trips to the dentist. According to the agency's recent health survey, 1/3 of Canadians haven't even seen one for a full year. Our Sean Preble joins us now to discuss these numbers and what dentists are saying. All right, so Sean, what does this new data tell us about barriers for Canadians when it comes to accessing dental care?
Well, thanks for having me, Miranda. When it comes to the numbers that Statistics Canada has released, we all know that Canadians are seeing a pinch when it comes to cost of living, whether it's at the grocery store, the gas pump, or when it comes to their homes. And now it looks like it's also impacting their teeth. Now, the numbers from Statistics Canada, as you've noted, said that more than 1/3 of Canadians say they have not gone to a dentist in the span of about 12 months, so a full year. And those numbers also found that more than 1/3 of Canadians, pretty much the same amount, say they don't have dental insurance. And the big issue here when it comes to why Canadians aren't going to the dentist, for many, it's because of that cost. Without insurance, they have to pay out of pocket. And some procedures when it comes to dental care aren't very cheap. So unfortunately, they're ending up having to find other ways of taking care of their teeth, or in some cases, not seeing a dentist at all. Miranda?
All right, so Sean, what are dentists saying about the number of people avoiding appointments?
Yeah, so when it comes to Canadians avoiding their appointments, again, they talk about the lack of insurance and the cost, but they also say the issue here is there is that need for care. When it comes to your teeth, it has a direct connection to your overall health. And the numbers also show it can really impact various groups. Members of the Canadian Dental Association spoke with me, said that low-income earners, persons with disabilities, many of these groups face difficulties getting dental care. And the biggest thing they stress is that preventative care needs to be available because of that overall impact it can have on a person's health. Dr. Heather Carr had this to say.
There's definitely indications that there's a big relationship between oral health and overall health. So that if you're not getting oral health care, it can actually impact you in many ways. And in oral health care, you want to get in early. You need to have that prevention, which will hopefully prevent the disease, and you want to detect it in the early stages, because if it's not caught early, then it can become a more serious condition.
All right, so Sean, given these numbers, what are some potential solutions for those struggling to meet their dental care needs?
Well, for Canadians who may not be covered by private or public insurance, such as through their workplace or through university, or maybe even getting that help from their parents, they can look into different types of insurance through different companies. But going back to what I said earlier, the big issue is cost. So for many, even getting insurance through other methods that aren't through their workplace isn't really an option for them. And that's why the dentist that I spoke with, including Dr. Carr, said that the federal government plan that they've announced could help. The plan is expected to cover those under 18, persons with disabilities, and seniors by the end of 2023, with the hope of getting up to 9 million uninsured Canadians by 2025. Now, we still are waiting for more detailed plans from the government when it comes to that plan, but the most important note that came from this story is that however you get dental insurance, get it. And the sooner that you can get into that dentist chair, the better for your overall health. Miranda?
All right, very important information there. Sean, thank you very much for that report.
Thanks for having me.
That is our Sean Preble reporting from the newsroom.